This hospital was started in 1926.
Actually, it started, if you can say, in 1922 is when the trust was formed.
Okay.
And in 1924 is when Vicereine Reading laid the foundation stone of the hospital.
Okay.
And of course, the founder was a Dr. S.P. Shroff.
Okay.
And after his training in Edinburgh, he had first started a clinic in Chandni Chowk in a dharamshala.
Oh.
And soon he realized that there is such a big need, and he was able to influence the then British government to give this piece of land, about 4.5 acres of land, for an eye hospital. And that must have happened around 1922.
Okay.
24 is when the foundation stone was laid, and in 1927 is the Vicereine Irwin inaugurated this hospital. Okay. Lady Irwin.
It's a lady Irwin.
Yeah,
okay.
so she inaugurated the hospital. Okay. Soon became very popular, and I think across North India, right from Lahore to Kanpur, this was the main eye hospital. And
during that time, it was so big, or
yeah, it's always been this heritage building that we have today, this colonial building, and it's been pretty much the same structure since that time. And it was developed as an eye hospital. And
so an online prescription of Mahatma Gandhi also.
Yes.
So who was the person who did the eye checkup?
So there used to be a Dr. Mathur.
Mathur.
Okay. Mathur. He was the CMO somewhere in between the 30s and I think right up to maybe something like 1950. And Dr. Mathur was Dr. Gandhiji's doctor.
Okay.
And he
was an eye doctor.
He was an eye doctor.
Okay.
And the history with Dr. Mathur is that subsequently he started a clinic which Dr. Hari Mohan inherited.
Okay.
And so Dr. Hari Mohan's clinic also has a Mathur memorial.
Oh, very interesting. I didn't know that.
Yeah.
Okay.
So it was Dr. Mathur at that time. But yeah, it has had a history behind it. Yeah, devices and books. And so myopia is quite on the rise, and looking at the need, we opened a myopia center, which is specifically looking at it. So the counseling can be done. Even if you are myopic, if you can reduce the progression of myopia, it's useful, because if you're -2 or if you're -10, it's very different. Because as the myopia increases, also the complications of myopia increase. You have a higher risk of retinal detachment, you have a higher risk of macular issues, which is the central part of your vision, can get affected. So the complications of myopia also increase. So if you can reduce the progression, even that is important. And so there are new ways to reduce it. Some are with some drops.
Okay.
But I think these new glasses that have come,
okay,
which blur the peripheral vision, and that probably reduces the progression of myopia. And so studies are showing good results with that. So you need to also document the progression. Okay. So the measuring of axial lengths, checking the corneal diameters. So myopia is generating a lot of interest right now, a lot of studies. And you're right, the Far East, they say the oriental population of Hong Kong, Taiwan, Singapore, China, in one generation from 30% myopia, it's almost 90% myopia.
Ooh. 90%.
So India may not be that high, but we can see that the urban area children are more myopic today, and it is on the rise.
So you have an optical store here. So does your team suggest the myopic lenses by SLR?
Sure. I think it's more at the optometry and doctor level. Okay. That they are suggesting to the parents and things, because they need to be counseled first, and then the optical shop is looking at that.
So can we go and see your place where you also work? Sure. And the optical store?
Sure. Children, there is a cancer called retinoblastoma, which occurs only in children and can be in families. So they need early intervention, but it can be salvaged. Not just the life, even the eye can be salvaged if detected in time. But in India, this expertise is not available, and so patients come very late. So we do chemotherapy, and even
chemotherapy is done here.
Yeah. Oh. And also the surgical work on them is done here.
So all these kind of treatments also are part of your charitable stuff?
In fact, most of it is, for some reason, these tumors are in the very poor. And so it's expensive treatment. Each child we spend a few lakhs, but we are fortunate there are people who support some of that treatment. So, but yeah, most of it is done free. I would say almost 75% of it the patient isn't paying anything.
Okay. So how important you feel is optical for you in this whole eye surgery setup and all OPD?
It's important because I think refractive error constitutes a significant part of visual impairment. So you are very incomplete if you don't take care of the whole refractive error business. And the problem even with spectacles is the same. I mean, if you don't have it at the right price point, patient will not afford it.
Okay.
So you have to again look at both access, cost effectiveness, and also spectacles, opticals as a business helps in the cross subsidy model.
Okay.
Because if you run it well, there are reasonable profit margins in it, and which should overall help the whole ecosystem.
Okay.
But it's a complex business. It's not because
for an eye hospital, I can understand.
Yeah, it's complex because there are variations in the lenses, frames. It's a fashion accessory at one level.
Managing the inventory, so many powers
and to be able to cater to all the different segments of the society. We do have a lot of children coming and concerned parents. So of course they are slightly at the expensive price point right now, but for those who can afford it, it is something that is giving good results.
Okay.
मैक्सिमम तो एसिलोर का लेंस हम बेचते हैं क्योंकि एसिलोर वर्ल्ड की नंबर 1 कंपनी है, बेस्ट प्रोडक्ट है और पेशेंट की सेटिस्फेक्शन को ज़्यादा है उसमें, पेशेंट डिमांड भी करता है आकर के एसिलोर के लिए, ठीक है ना। तो हम एसिलोर की हमारी फर्स्ट प्रायोरिटी एसिलोर होती है। जैसे अगर सिंगल ब्रांड की बात करें तो हमारे जैसे क्रिजाल है, क्रिजाल रॉक है, ये देते हैं। और प्रोग्रेसिव में तो देखिए वेरिलेक्स जिनका सबसे बेस्ट लेंस है, कंपनी ने इनोवेट भी किया है एसिलोर ने प्रोग्रेसिव को। तो इसमें जो वेरिलेक्स रेंज है, तो क्योंकि यहाँ पे हमारे जो हॉस्पिटल है वो चैरिटी हॉस्पिटल का एक नाम लगा हुआ है, जिसकी वजह से थोड़ा प्राइस सेंसिटिव रहता है, तो इसलिए हम प्रोग्रेसिव में तो जो वेरिलेक्स में लिबर्टी और कंफर्ट थोड़ा कम रहता है, बट एसेंशियल जो है इनकी वो हमारे यहाँ ज़्यादा सेल होती है।
हॉस्पिटल है तो यहाँ लोग आके पूछते होंगे कि हमें यूवी से बचने के लिए क्या
बिल्कुल बिल्कुल पूछते हैं, तो हम उसके लिए हम ट्रांजिशन रिकमेंड करते हैं। ट्रांजिशन में सबसे फास्ट डार्क होता है, जल्दी क्लियर भी हो जाता है, इसलिए उसको रिकमेंड करते हैं। कई कलर्स उसमें आते हैं, अवेलेबिलिटी उसमें अच्छी है। और सबसे बड़ी बात है कि एसिलोर में फास्ट सर्विस है और कोई भी किसी तरह का इश्यू हो तो इजीली सॉल्व हो जाता है फटाफट।
आज के डेट में मायोपिक के बारे में बड़ी चर्चा
बहुत, हाँ जी हाँ जी, हम बिल्कुल आते हैं। हम स्टेलिस्ट लेंस को हम रिकमेंड करते हैं क्योंकि उसमें हार्ड टेक्नोलॉजी का इस्तेमाल किया हुआ है, तो मैक्सिमम हम उसको स्टेलिस्ट ही सेल करते हैं।